Hello and welcome to Lumilix Health. Today, we're tackling a popular topic, intermittent fasting. It's everywhere, often praised for weight loss and metabolic health. But if you have diabetes, you need specific information. Can intermittent fasting work for you? Is it safe? Let's find out. Intermittent fasting isn't about what you eat, but when you eat. It involves cycling between periods of eating and voluntary fasting. Common methods include the 16/8 method, where you fast for 16 hours and eat within an 8-hour window. Another is the 5-2 diet, eating normally 5 days a week and restricting calories significantly on 2 non-consecutive days. For some people, intermittent fasting can lead to weight loss. Losing even a small amount of weight can improve insulin sensitivity, which is beneficial for type 2 diabetes. Some studies suggest it might help lower blood sugar levels and reduce the need for certain medications over time. It could potentially improve metabolic markers. However, intermittent fasting carries substantial risks, especially for individuals with diabetes. The most immediate concern is hypoglycemia, or dangerously low blood sugar. This is particularly risky if you take insulin or certain oral diabetes medications. Fasting while on these medications can cause blood sugar to drop too low, leading to dizziness, confusion, or even loss of consciousness. Conversely, there's also a risk of hyperglycemia, or high blood sugar. This can happen if you overcompensate during eating periods or if your body's glucose regulation is already impaired. Timing of medications becomes critical and complex with fasting schedules. Skipping meals can interfere with how your medication works, making it less effective or causing dangerous fluctuations. Given these risks, attempting intermittent fasting with diabetes without strict medical guidance is strongly discouraged. Your healthcare provider understands your specific condition, medications, and overall health profile. They can help determine if you are even a candidate for intermittent fasting. They will assess your type of diabetes, current blood sugar control, and any complications. If deemed potentially suitable, your doctor will help you create a safe plan. This includes adjusting medication dosages and timing to align with your fasting schedule. Close monitoring of blood sugar levels is absolutely crucial. Your doctor will advise you on how often to check your glucose and what numbers require immediate action. Intermittent fasting is generally not recommended for people with type 1 diabetes due to the complex insulin management required. The risk of severe hypoglycemia or diabetic ketoacidosis is too high. It's also often unsuitable for individuals with a history of hypoglycemia unawareness, eating disorders, or those who are pregnant or breastfeeding. People with certain complications like kidney disease may also need to avoid it. Even for type 2 diabetics, it's not a one-size-fits-all solution. It requires careful planning, consistent monitoring, and open communication with your healthcare team. Intermittent fasting shows promise for metabolic health and weight loss, which can benefit some people with diabetes. However, the risks of blood sugar fluctuations are significant and potentially life-threatening. Never start intermittent fasting if you have diabetes without first consulting your doctor or a registered dietitian. They are your best resource for determining if it's safe and how to do it correctly for your individual needs. Want better control over your blood sugar naturally? Glucose 6 works differently by easing the pressure on your glucose receptors using a special sugar called sucre and Mediterranean nutrients. Click the link in the description below to see how it works. Your health and safety are paramount. Always prioritize evidence-based strategies and professional medical advice when managing your diabetes. Thank you for joining us on Lumilix Health. Stay informed and stay healthy.